Consequences stemming from healthcare unaffordability have severe complications for the health status of disproportionately affected populations, as they experience shorter lives due to higher rates of disease, injury, and disabilities. These rates are worsened due to delayed detection and inadequate care of chronic diseases. Thus, rates of premature death are higher in poor populations, with many affected populations suffering from chronic diseases for life and can be incurable. This is also the reason why the life expectancy between the rich is 10 to 15 years longer than the poor, with this gap increasingly becoming drastic in recent years. As affected groups are burdened with higher costs of healthcare, they adversely burden the American healthcare system with worse quality of care and population health. Consequences of healthcare unaffordability can even be seen in our healthcare centers. During the decision-making process of treatments, patients are barely involved, but rather act accordingly based on their physician's wishes and suggestions. While physicians claim they act in compliance with the patient's best wishes, patients feel a lack of mutuality, which reduces adherence for future treatment plans, which will only harm population health. In fact, according to clinical researcher at Harvard University Vika Saini, 20% of elective procedures would be unwanted by patients if there was relevant clinical information that is both accessible and understandable. Only until recently has more attention towards measuring health disparities, with sporadic guidelines becoming adopted to reduce inconsistencies in our healthcare system. More people who have coverage are underinsured than adequately insured, with the greatest occurrence among those with employer plans. Among the populated uninsured citizenry, they regularly report cost-related problems receiving care and difficulty paying medical bills. This drives underuse of treatment plans and lack of desire for available procedures similar to during the decision-making processes at clinical centers. Next, we will focus on policies that target healthcare unaffordability in America.